I'm Dr. Zaidi. I'm an endocrinologist. Over the last 20 years, I must have treated thousands of patients with hypothyroidism and Hashimoto's thyroiditis. Today, I'll help you to understand the following. Number one, why traditional approach to hypothyroidism and Hashimoto's thyroiditis does not work in a vast majority of patients. Number two, what are the pitfalls in the interpretation of thyroid blood test? Number three, why you keep having symptoms of hypothyroidism even though you are on a combination of T4 and T3 and your blood test is perfectly normal. Number four, what really causes hypothyroidism? Number five, what really causes Hashimoto's thyroiditis? Can we cure it? So let's start with the first one. Why traditional approach to hypothyroidism and Hashimoto's thyroiditis does not work for a vast majority of patients. And by the way, traditional medical approach has no treatment for Hashimoto's thyroiditis. So let's get some basic endocrine facts about thyroid in order to understand at a deeper level about the treatment approach. So thyroid gland sits right here, low in your neck. It's shaped like a butterfly. It has a right lobe, left lobe, and a bridge in between connecting the two, and the bridge is called isthmus. So normally thyroid gland produces two hormones, T4 and T3. Now, T4 and T3 get in blood circulation and reach all the tissues, all the cells in the body. Now, inside the cell, T4 get converted into T3. And it's the T3 that finally binds to thyroid hormone receptor, which is located inside the nucleus of the cell. So in the end, it's T3 which is the active thyroid hormone, not T4, T3. Now T3 comes from two sources. About 20% of T3 comes from thyroid gland directly, and the remaining 80% comes from T4 to T3 conversion inside the cell. So the treatment, the traditional approach consists of basically just one thing, levothyroxine, which is T4. Now we have already established that the active thyroid hormone is T3, not T4. So you are having low T3 and they are giving you levothyroxine, which is T4. Do you see the problem? And by the way, levothyroxine comes with the brand names of Synthroid, Levoxil, Unithroid. So the usual explanation that your physician may give you, that oh, you take this Synthroid or Levoxil, yeah, it is T4, but it will get converted into T3. Surprisingly, he or she may not even check your T3 level to see if his or her hypothesis is actually true or not. Even if the hypothesis was true that you are converting your T4 into T3, you will still lack 20% of T3 that comes directly from thyroid gland, isn't it? So you will continue to be low in T3 and you will continue to suffer from symptoms of hypothyroidism. And here's another fact. In the vast majority of people, this T4 to T3 conversion doesn't take place properly. For example, patients with Hashimoto's thyroiditis, which is one of the major causes for hypothyroidism. In these patients, immune system is hyperactive and it produces what we call cytokines, which are chemical substances in the body. And these cytokines interfere with the conversion of T4 to T3. Same way, obesity. There is inflammation in the body, immune system is overactive, and those immune cells are producing cytokines which interfere with the conversion of T4 to T3. Stress of daily living produces a lot of cortisol which interfere with the conversion of T4 to T3. So I hope you understand that this conversion of T4 to T3 gets interrupted in the majority of patients, because a lot of patients that I see, they have Hashimoto thyroiditis, they have stress, and they are overweight, and there are even commonly used drugs such as beta blockers, steroids, that will interfere with this T4 to T3 conversion. So in the vast majority of patients, this conversion does not take place normally. That's the reason you keep taking this levothyroxine, such as Synthroid, Levoxil, Unithroid, and you continue to suffer from low T3 and symptoms of hypothyroidism. Okay, let's move on. So what are the pitfalls in the interpretation of thyroid blood test? The usual blood test that your physician orders for you is TSH, which stands for thyroid stimulating hormone. It is not your thyroid hormone. A lot of patients think that TSH is the thyroid hormone. It is not. It's a hormone produced in your brain in a tiny gland called pituitary gland in response to your thyroid hormone. So if your thyroid hormone is low, your TSH goes up. If your thyroid hormone is high, your TSH goes down. So I've seen patients, they have asked me that my TSH is low, that means my thyroid hormone is low. You can understand now. If your TSH is low, there is a chance that your thyroid hormone may be too much. So let's look at this TSH a little more. The TSH reading actually can be misleading, and this is why. The normal range for TSH reported by labs is 0.4 to 4.0, which actually is not accurate, is not correct, and most endocrinologists know that. Most internists and family physicians may or may not know this. The normal range for TSH should be 0.4 to 2.0. That's it. Now consider this, your TSH is 3 and you and your physician may think it is in the normal range, so you are fine. Actually you are not. You are actually having hypothyroidism. And here's another problem with TSH. TSH produced by the pituitary gland, not only it is produced in response to your thyroid hormone, it also gets affected by a lot of other factors, such as cortisol. such as depression, such as stress, such as steroids. And there's a long list that can affect your TSH. That's why to diagnose hypothyroidism and to follow up patients and using just TSH as a marker can be misleading. So the other thyroid blood tests include T4 and T3. Now usually physicians just order TSH and at the most T4. Sometimes they may add T3. Now T4 and T3 comes in two forms. One is called total T4 and total T3, and a very tiny fraction of total T4 and total T3 is present as free T4 and free T3. It is this tiny fraction that is available to tissues. So it makes sense not to order total T4 and total T3, but to measure free T4 and free T3, right? Because there are conditions where your total T4 and total T3 will be falsely elevated, whereas your free T4 and free T3 will be normal. And one such example is birth control pills. Okay, so next time your physician orders your T4 and T3 levels, make sure it is free T4 and free T3. So let's move to the next step, that you are seeing a physician who is giving you T4 and T3 combination therapy, and your blood test is looking perfectly normal, but you are still having symptoms of hypothyroidism. And now you and your physician are totally puzzled. What's going on? In these cases, this is what I have seen in my patients, and I see a lot of patients like this. The normal range for free T3 is quite wide, and you may be in the low normal range of that free T3. So once I raise their free T3 level to the upper normal range, these patients feel wonderful. Two, you may be having other medical problems which mimic hypothyroidism. One example is vitamin B12 deficiency, which is very common in patients who have Hashimoto thyroiditis, very common in people who are vegetarian. Now, vitamin B12 deficiency will cause fatigue, will cause weight gain, and will cause thinning of hair. Three most common symptoms I see in my patient with hypothyroidism. Or you may be having vitamin D deficiency, which is an extremely common medical disorder, and physicians usually don't even order vitamin D level, so it remains undiagnosed. So you may be having vitamin D deficiency. Or you may be having a lot of other medical conditions such as adrenal insufficiency, adrenal fatigue, and there are a lot of mineral deficiencies such as magnesium deficiency, and it causes symptoms which are very much similar to symptoms of hypothyroidism. So now you can see that your symptoms of hypothyroidism are not caused just by hypothyroidism. The same symptoms are caused by a variety of other conditions, and your physician needs to look into those. really causes hypothyroidism? There are various causes for hypothyroidism. One common cause is Hashimoto's thyroiditis, which is an autoimmune dysfunction. What is an autoimmune dysfunction? An autoimmune dysfunction is that your own immune system that is designed to protect you against viruses and bacteria, it turns against you and it starts attacking your own tissues such as thyroid gland. That's when we call it Hashimoto's thyroiditis or autoimmune thyroiditis. There are many other causes for hypothyroidism too, and often they exist together. For example, obesity itself is a cause for hypothyroidism. And when you're hypothyroid, you gain more weight and you become more hypothyroid. So it's a vicious cycle. Stress, another cause for hypothyroidism, because stress produces a high level of cortisol, and cortisol, as I discussed earlier, interfere with the conversion of T4 to T3 in your tissues, and it also interfere with the production of TSH. Net result, you become hypothyroid. And sometimes it's our eating habits. If you eat too much soy, for example, you become hypothyroid. So you can see there is a wide variety of causes of hypothyroidism, and often they coexist in the same patient. Okay. Next, let's look at what really causes Hashimoto's thyroiditis and can it be cured. Hashimoto's thyroiditis is caused by genetics, yes. It occurs more frequently in females with a ratio of about 6:1. And pretty much that's where the usual medical knowledge ends. So about 20 years ago, I looked at it myself using my knowledge of endocrinology and my observations in my own patients. That what really causes Hashimoto's thyroiditis, the risk factors which we can modify. Of course, there is nothing we can do about genetics. So I call them as modifiable risk factors. And this is what I found. Number one, stress of daily living, the major cause for Hashimoto's thyroiditis, including all other autoimmune dysfunctions. Number two, vitamin D deficiency. Number three, diet. We are eating very unhealthy diet. So I got this strategy where I developed my own diet, and it is not your usual gluten-free diet. I'm seeing patients who've been gluten-free for several months or even for years, and they're still having Hashimoto's thyroiditis. So the diet that I have is, and actually gluten-free diet that you buy from supermarkets is often loaded with a lot of corn, a lot of rice and a lot of other unhealthy products. So the diet that I have is a comprehensive diet. It's not a tunnel vision diet, and it's a healthy diet, and it comprises of real food items. Vitamin D deficiency is extremely common. It's probably one of the commonest medical disorders we humans are facing today. And actually vitamin D is not a vitamin, it's a hormone. and it affects almost every cell in your body. Hormone D is important for the normal functioning of immune system. So when you are low in hormone D, you are at very high risk for developing autoimmune dysfunction. Now you may start taking a small dose of vitamin D and think that that will be enough. Guess what? When it comes to autoimmune disorders such as Hashimoto's thyroiditis, low doses of vitamin D don't work. You need high doses of vitamin D. And this is based on my own clinical experience. Stress of daily living is a major cause for Hashimoto's thyroiditis. So I looked at it, explored it myself. I'm not talking somebody is stressed out because of some external situation. They come and go. What I'm talking is an inner stress, which is there all the time. You are sitting on a beach in Hawaii and you are worrying about this and that. Your mind is busy and creating stress for you. That's the stress I'm talking. Inner stress is always there with you. And what I've found, that this inner stress in the form of anxiety, worrying a lot, is the major reason that causes autoimmune dysfunction. So I put this strategy in my clinical practice, where I have my own approach to treat stress of daily living. I have my own diet, and I prescribe these high doses of vitamin D in my patients. And with that approach, I'm seeing some amazing results. Just a couple of months ago, there was this patient that comes to my mind right now. And her thyroid antibodies were about 35,000. Those are the highest level that I've seen, 35,000. Normal being less than 10. So I put her on this strategy, and I saw her again in 2 months, and her thyroid antibody level had come down by 13,000. Just within 2 months, a drop of 13,000. I have patients that their thyroid antibodies come all the way down into the normal range. So, can Hashimoto thyroiditis be cured? Absolutely. I'm seeing it in my patients. So, we'll wrap it up here. And if you want to know more about my strategy and all the other issues that I've discussed, please refer to my book titled Hypothyroidism and Hashimoto's Thyroiditis. I also have my website where I have a lot of information, and it is called dr.zaidi.com. Thank you.